Rags, then I'll turn it over to Bryce to introduce today's program.
Today, Tim Schauermann offered to talk to us about what's going on at Pacific with this currently underway now semester and everything going on in our wonderful reality. So take it away, Tim.
Let me start with a couple of caveats. I'm a board member of a 35-person board. So today I am not speaking for the other 34 people, and I'm not even speaking for the university. I'm going to speak from what I call the 30,000 foot level. I'm not an administrator. I haven't been there the last week, and things are changing not by the day, but by the hour. So you're going to get my view from 30,000 feet with a few inputs from the president in the last few hours. As you all know, colleges all over have opened and immediately shot down. Some of the great ones, Notre Dame, Oklahoma, Tennessee, Michigan. COVID has grabbed them, and they have had surges in cases, mainly involving parties and alcohol, that have spread across their campuses. As far as I know, there have been no deaths, but they are having wildly surging cases and have forced themselves to shut down. So given that we're in a very difficult position, we have taken the position, and we started taking it last March when this hit, that we're going to do everything we can possibly do to be as open and in person as we can, but we made at least a dozen plans to be either open or 100% virtual or something somewhere in between at almost every level of the college. We had staff, professors, administrators working literally for the last 6 months preparing for this week. I'm going to say it's the most cooperative thing I have seen across the spectrum of levels of control of a university. It's from the president down to the janitors through the faculty, that everybody wants us to be open but safe. That has been the plan from the start. They've formed dozens of committees. I really mean dozens of committees to deal with different aspects of how we stay distance, mask, clean, feed everybody, and don't get a spread if we can possibly stop it. And if something happens, immediately within a day, pivot again. Pivot to something else to see if we can stay out of virtual 100% somewhere where we have some people in class and maybe some virtual. That is exactly our plan and has been the plan for 6 months. We have a couple of advantages, in my opinion, against most colleges in America. The first and biggest is that we have half of our student body are graduate professional students, and 80% of them are in the medical field. They also attend class year-round. They don't get the summer off. So we have had hundreds of students still attending from March until today, all through the summer in the graduate professions, in the health professions. And if you think about it, stopping infectious diseases, staying clean in their workplaces, wearing masks, socially distancing is what they do in their careers all the time. It's not something new for them. It's a class they take on how to not infect your dental patient or infect your physical therapy patient or treat somebody that already has an infection without getting it yourself. So we have used that as a test lab for things that we ought to learn from them and carry over to the undergraduate students. It's an advantage that many schools don't have. What I'm telling you is we've already been 6 months into this, trying to come up with a plan or plans that can work. And I think it seems that it's helped us and got us in a position to be ready. Now, nothing to do with COVID. There are a couple other things about us that we think are going to help carry us through this. I mean, we could have a failure. We could have 100 kids go to a party, spread it all over the campus and have to close down. But at this point, that hasn't happened, and we're trying to stop it from happening. We think we have a unique blend. We're about 50% undergraduate students and about 50% these graduate professional students. It gives us diversity in class teachings, diversity in finances. If one budget gets hurt, the other one may not. We have enough spread in different kinds of classes, and we are a complex enough place that we think we have room to pivot if something goes wrong. And that is what the plan is built around. If something goes wrong, how can we shift it a little bit and not have to close like Notre Dame did? We also had something terrible happen 20 years ago that I think prepared us for this. We almost went bankrupt. We were within a year or two, if it would not have been fixed, of having to close Pacific down. That's a full 20 years ago. What I will tell you is it got our attention, and it has become embedded in everybody in the university how easily something like that can happen. We have spent 20 years changing culture. We've changed the culture to everyone believing, and I mean believing, that financial success is as important as teaching classes. That if we go bankrupt, there will be no classes to teach. Throughout the whole organizational structure, we have produced budgeting that didn't even hint to begin 20 years ago. We budget every year. We hone the budget 2 or 3 times during the year. We have gone 20 years after some disasters of dropping a profit to the bottom line every single year for 20 years. And that doesn't mean there haven't been times where, whoops, we thought we were going to get an X number of students, but we got 100 less. But if you have good budgets and understand where your pivot points are, you quickly solve those problems. And we think it's going to help us here again in being able to understand our budgets as well as anybody can possibly understand them, and not just the chief financial officer, but everybody throughout the organization. Being understanding of how they affect the budget and what can happen in their unit and what we can do to fix things if we miss budgets. So we think that a disaster helped us plan for 20 years how to probably deal with what might happen here. The other thing we have, and so does Willamette and Linfield and Lewis and Clark, is we're smaller than Oregon State and Oregon and Michigan and Notre Dame, and we can be more nimble. We have the opportunity to shift and do something different way easier than institutions with 30 and 40 and 50 and 100,000 people. And another advantage we have, again, against those big places, is that athletics is not a significant part of our budget in any way, shape, or form. We can stop athletics and not take a budget hit. We get no TV money, and we never have. We get no gate money of any significance whatsoever and never have. So whatever we do with athletics, we fund out of other budget sources, and we are not going to lose any money at all shutting off athletics. Like Oregon and Oregon State and Michigan and Notre Dame, they're going to take hundreds of millions of dollars of budget hits, hundreds of millions. We're going to take none. And we have already, with all the rest of the conference, shut off sports until at least the end of the year with no budget consequences. In fact, it's really interesting, and I learned this just a few days ago in talking to the president. We had thought that we were going to have to hire quite a few employees, maybe 10, 20, 30, 40, to help us deal with Uber Eats. We can't put all the students in a 500-person cafeteria together and stop spread. So we were trying to figure out ways we could deliver food to rooms or have them pass by somebody outside and hand them a tray or something. And we were going to have to find a way to test the students and track, if one of them has it, track all their contents. And we thought we were going to hire a significant number of people. What we've done is taken the athletic department and repurposed them. The coaches have nothing to coach this semester. The athletic director has nothing to direct this semester. We've repurposed dozens of people and not hired a whole bunch of new people strictly to deal with COVID. So again, not having athletics as a budget issue. It's not that it's not important to us. It's not a budget issue. I'll tell you how important it is. 60% of our 2,000 undergrad students have at some point in their 4 years been on a varsity team. 60%. I took a look at University of Oregon. It is such a fraction of 1%, you can't even measure it. Yet it's a huge budget issue for them. So it's important. We've got 60% of our students who right now can't do something they love to do. But we're not taking a money hit over that something they can't afford to do. So what did we do to get ready? Lots of things. We've tested or have the idea of testing every graduate medical student all spring and all summer to see what works, what doesn't, how fast the test can come back, what we can do with them. If we find somebody with COVID, how do we handle them? We've been testing students for 6 months. We prepared the whole campus for a hybrid social distance. We've put up plastic screens like you see in the restaurants. We've spread out classrooms with less chairs in them. We've calculated under the governor's rules how many people you can put in X number of square feet. And we fully intend to use all those distancing measures to keep the kids as spread out, the students, as far as we can possibly keep them spread out. We've had to dig into the curriculum. And many of these ideas didn't come from the top, they came from the bottom back up. We have professors who are as old as 70 and 75 years old, and some as young as 30. Everybody knows that this disease is a problem for older people, particularly with underlying conditions. So our professors got together. I'll just give you an example. The chemistry professors got together and they had an old chemistry professor who was scared to death they might get it and get sick and even maybe die. So the chemistry professor said, well, here's what we're going to do. You are going to stay home. You are not going to come to campus. And you are going to virtually give all of our lectures. So you better get ready to lecture on organic chemistry, Chem 101, Chem 102, everything you can think of. You're going to give the chemistry lectures this next semester. We younger 5 or 6 chemistry professors are going to wander around the classroom and help. We're going to do the labs. We're going to help them with their homework. And we will be in the room. You won't be. Go home. So that is a change in curriculum that's huge. You generally would have one person teach organic chemistry for years and years and years, and that would be the only thing they taught. But our professors have figured out that if they follow a method like this, they can all work together, keep teaching their discipline, and take the people who might be subject to COVID and get them out of harm's way. We've put up signs everywhere about social distancing. If you notice, any of you, when you try to enter the campus, you're asked not to. We don't want anybody who doesn't need to be there, and that's a student, faculty, or professor on that campus. We don't want one person to somehow wander in and start giving COVID to everybody else. The campus is closed. We have more rules about masking, distancing. They're printed, they're sent to their parents. We're giving speeches about it as they arrive on campus. We're handing out flyers, everything we can think of to convince them that if they make the mistake the kids at Notre Dame do and go to a 100-person alcohol party, they likely will shut the university down. And for sure, even if they don't, we're going to send that 100 people home. We've had to make sure we can dine without being in a large dining hall. And we've done that without hiring extra people. We planned to rent off-campus space, the theaters in town, church or auditoriums, so we could have big open spaces so that you could get 30 kids together, but keep them 6 or 8 feet apart. We've ended up not doing that as of this week. It doesn't mean it wouldn't change next week, because we found that we can set up hybrid situations where half the kids are in a class, half are sitting back in their dorm room virtual, and the next week or the next day we flip them. So we have so far been able to stay on campus, and we've added tents. We're going to do all the teaching we can outdoors under tents where the virus can't spread as easily as in confined spaces. We hope that'll help. We have strict consequences if we find people violating the order, up to sending them home, and we've told they and their parents that. The other thing we've done is education, 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 communication. We are constantly, in the first week, telling everyone that they have to mask, they have to socially distance, they have to follow the rules. And if they don't, we end up in a shutdown situation. So follow the rules. This is serious stuff. Don't you be the one that shuts us down by spreading COVID. So what do I know has happened in the last week? We have students back. First thing I'm going to say, we've been, as I said, we've spent 20 years working on budgets. We're working them daily now. We are going to take a huge budget hit. It will not be $1 million or $2 million. It'll be 10 million and more. We're going to take a huge budget hit, but we have already determined we can afford it. It's that discipline of 20 years. We've figured out that as bad as 10 million budget hit is, we will find a way for that not to bankrupt us. We will move money around, people around. We'll find a way to balance that budget even with a 10 million hit. And we're confident as of today, we can still do that. So what are the numbers? As of this morning, we have 692 students who are resident. That means they've come and they're in the dorms. This is 300 short of normal. So we've got a hit in trying to collect room and board. We got 300 kids who we would normally have in those dorms, eating our lunches and our food, not there. But undergraduate enrollment as of this morning is 600 students. That's less than 100 short of what we normally would have expected. That's in the undergraduates. 1,600 students, down about 100. We have 379 students who have paid tuition and are signed up, but stayed at home and elected to be virtual. That's why the dorms aren't full. Our graduate enrollment has not wavered at all. We still have all the physical therapists and dental hygienists and physician assistants coming, paying tuition and coming to school, but using their expertise and their discipline to help us keep COVID at bay. We've tested, as of this morning, 1,100 students. Every one of them is negative. And I'm shocked. That's all I can say. I am shocked. They came to campus negative, all 1,100 that walked through our testing. We had 4 students who had symptoms. That was this morning at 8 o'clock. At 11 o'clock, I got an email. They're all negative. It's something other than COVID. 2 of them had stayed in Hawaii, afraid to fly. They got on planes this morning. We've repurposed lots of employees, so there are no new hires anywhere. All positions are frozen. If somebody retires, we're not going to replace them. It's one of our techniques of matching up our budget. We've repurposed everybody in the athletics department, every single employee. Some classes are still going to be remote only, even if the kid's on campus. We haven't figured out in some cases, either because of the professor, the space, or something, how to not have it be virtual. So we're having them virtual if we have to, but if we can, we're getting them in person to the class or an outdoor tent. I'm going to finish with reading something that came from the president this morning on this problem that everybody else has had, which is parties. I'm going to suggest that stopping 18 to 22-year-olds from partying, alcohol, sex, and whatever else is like trying to defeat the wind. It's really going to be hard. It has been the failure of everybody who has failed so far. It won't be easy, and if we fail, it'll be the issue. Here's what the president said. To stop them from partying and drinking, we are begging them to effectively distance and stop the spread. For now, using mostly positive reinforcement, but fully prepared to use the discipline process if need be. Lots and lots of communication, signs, reminders. And I've been in touch with all 6 of the other private institutions presidents, that's Willamette and Linfield, and they're all using the same communication. So far, at all these campuses, things are going pretty well. Mostly a lot of peer pressure and the threat that we will close the university down if they don't do what we ask. The other schools have also had a few cases where they think somebody's had it and they have immediately separated them, quarantined them, and got them out of the way. But so far, of these local small colleges, nobody has more than a handful. We're not having hundreds or thousands of kids go to parties and come back and within a week have COVID. But we haven't had quite a week yet either. We are continually telling them we're going to send them home. Not because they get COVID, but if we find out they've been partying. With that, I'm going to end. Maybe somebody has questions, and I know we have a couple staff members here, and if I don't know the answer, and if it happened in the last 15 minutes, some of them may know the answer, so fire away.
Well, I have my first question is, what about off-campus students? Are there extra measures taken for off-campus students? And what about intramural activities? Are those still going to happen?
We are not going to have sports where people brush against each other, touch each other, sweat on each other. It won't happen. Off campus, frankly, we have no control other than telling them that if we find out you've been partying, we don't care if you live on campus or off. If we find out you're at one of these big group parties, you are going to be expelled.
Hey, Tim, what's the plan when the weather changes? I mean, it's all fine and good now, but you know, when it starts raining nonstop for 4 months, where are you going to shoehorn all these kids?
We're going to use spaces that we might have used for other purposes. We've got a field house, we've got gyms, we have some big open spaces, which frankly, a lot of the time probably aren't in great use, or they're in use by a sports team, and they aren't gonna be. There'll be no baseball team practicing in the field house until at least next year. So we will use those big open spaces where theoretically, at least, you might be able to put 6 or 7 or 8 classes and spread them out by 50 or 60 or 70 feet and go on and teach. We're going to stay outside even if it gets cold. Rain may be another problem, and temperatures down into the 40s and 30s, but we'll probably tell them to wear jackets.
Is there a tuition difference between students that are doing all virtual versus those being actually physically on campus?
No. Here's our problem. While from the buyer's standpoint, they're getting less of a product because you don't get a B in with a professor. From a cost standpoint, we can't cut the professor's pay in half because he's only teaching virtually. Our costs will continue. And so if they want a good chemistry professor and a good math professor, and they want to hear what that person can teach them, we have to pay that person their salary. We are not suddenly finding some slashing of salaries, and we're not laying off a whole bunch of professors. So our cost structure doesn't change, whether they're virtual or in the class. And 80% of our costs are payroll.
This virtual teaching has to do with a good platform that's stable. Do you have access to more than one platform for online?
I can't answer that question because the IT people haven't briefed me, but I can say this. At a high level, what we've been told is we have all the capacity that we'll need to do this, and we've been building it for 6 months. We've known this is coming, so we have budgeted more money than would be normal for IT to build capacity into the system so that virtual will work.
Tim, I can piggyback on that with Sydney taking a class. First of all, the university's had a lot of online platforms that they've used for a number of years as supplementary programs like Chalkboard, Moodle. With the changeover to a hybrid or all virtual in some cases, professors are using Zoom either for at least one class a week or in some cases exclusively to teach. And you know, they're supplementing as best they can with these other online platforms that they have had in place for really a number of years. So especially in the college environment, there's been a buildup to this online education and having it ready to go for some time.
And I'll just repeat what I've said. Because we've had 6 months with our graduate schools, we've figured out what we have to do with all those issues and been planning for it and spending for it so that we're ready now.
So has Pacific University had any layoffs during the because of this?
The answer is no. We did use the same technique many institutions have of putting some people on 80% pay, 4 days a week instead of 5, and having them collect unemployment. We've used that to a pretty good extent in some places for some employees, which left them held harmless, but we kept them as employees. We also, there was a stimulus package, which individuals got up to $1,200. Universities were included. We got over $1 million. So we're using that to help balance budgets and backfill where other revenues lost.
Have you seen a change in donations from alumni? Anybody else that donates
A
regularly?
great answer on that. I can give a partial answer. We immediately started up a brand new donation fund for students who are going to be adversely affected because of this, because they don't have a summer job for whatever reason. And it has, I believe, so far in the neighborhood of 200 to 250,000 has been donated to that specific COVID need fund. What's happened to our general fundraising, I can't tell you. It's so long-term. I mean, many of the donations we get are long-term. They're out of peaceable estates. We collect the money over 10 or 20 years. What I can tell you, nobody stepped up and handed us $1 million or $2 million or 10 million because of this. I don't know if our general level has increased or decreased a lot. All I can tell you is we have a fund that has had a few $100,000 put in.